Welcome back. I'm Dr. John with 𝐬𝗫𝗁 Physical Medicine. Today we're going to talk about stenosis, particularly how stenosis occurs in the spine. So stenosis is a term that means narrowing of an opening. And when it occurs in the spine, we're talking about the narrowing of the openings of the spine. Stenosis affects 90% of the people 50 years of age and older, so it's quite common. And the symptoms of stenosis can start with very mild symptoms like maybe pain and stiffness in the neck, all the way to severe pain. Stenosis can occur in any region of the body, in the cervicals, in the thoracics, and the lumbars. And like I said, it could be very mild to very severe. Now, stenosis, let's take a look at a model of the spine. Now, this is a model of the joint of the spine, and I really want you to pay attention to the disc. So this is the disc, and it separates the two spinal vertebrae. Now, the whole integrity of the joint, in my opinion, is always based around the disc. So once the disc loses its integrity, such as a disc bulge, or if the disc becomes desiccated or dehydrated and loses its ability to act as its natural shock absorber and to keep the spaces between the bones, it will create stenosis because these bones will touch each other and occlude the openings of the spine. Now, let's talk about the three openings in the spine where stenosis occurs. Well, the first one is this opening right here, which is the central canal, and you can see this orange structure is the spinal cord. So this is the central canal or the neural canal, and the structure that goes through that is the spinal cord. And when this opening becomes narrowed or occluded, which is stenosis, it's referred to as central canal stenosis, and it puts pressure on the central canal. That's the first place where stenosis occurs. The second place where stenosis occurs is this opening right here, and that's called the neural foramina. Now this is where the nerves exit the spine. So if it was in the lumbar spine, this is where the nerves would exit to form the sciatic nerve, which go down to your legs. So when this gets occluded, this is called neural foraminal stenosis. The third opening where stenosis can occur is between the central canal, where the spinal cord is located, and the neural foramina. And that area is called the lateral recess. And when that opening is occluded, it's called lateral recess stenosis. I'm Dr. John. I'll see you in the next video. It's a pleasure.